Hey, I'm Tim Smith, founder of Medicare Prep, one of the leading Medicare educational platforms in the country. Every month, over 4 million people tune in to our Medicare updates, and we've built one of the largest social media communities in the US, focusing entirely on helping seniors like you make confident, informed Medicare decisions. I work with individuals in all 50 states, and best of all, everything we do here is completely free to you. There's no charge to speak with us, ask questions, or even have us walk you step by step through the Medicare enrollment process. In this workshop, we're going to be going over how to avoid costly Medicare mistakes and Medicare penalties, as well as when you should enroll into Medicare and what plan options you have available to you. And the best part, it's only 20 minutes long. How is that even possible? We have spent 5 years crafting our presentation so that anybody, no matter how confusing Medicare might be for you can fully understand exactly how Medicare works in this short presentation. Now, we are extremely busy because we meet with people all day, every day, going over their Medicare enrollment decisions. So, that being said, watch this Medicare workshop all the way through and make sure to secure a spot on my calendars where we can have a one on one call to go over all the specific plans in your area and set up an exact game plan for you moving forward. It's 100% free of charge since we get paid through the carriers to help you, and it's going to save you thousands of dollars and a lot of headaches going through the Medicare process. Now let's get into the workshop. Welcome to our Medicare 101 workshop. I believe we found a way to simplify Medicare so that anybody can understand it. So let's start off with the basics. What is Medicare? Medicare is the federal healthcare system for individuals over age 65 and certain individuals with disabilities. Who is eligible for Medicare? Now, there is one requirement that you or your spouse must have worked a minimum of 40 quarters or 10 years according to Medicare guidelines. So you must meet that requirement and have what they call a qualifying event. A qualifying event is essentially just a life change that allows you to get onto Medicare. And the three most popular qualifying events are number one, turning 65. So you're eligible for Medicare when you turn 65. Number two, drawing Social Security disability income for 2 years makes you eligible to get onto Medicare at that time. And number three, coming off of group coverage. You may be watching this video and you're considering working past age 65, and you may decide not to take out Medicare at age 65 and take it out when you retire a few years down the road. That is a qualifying event to get you on Medicare at that time with no penalties. Now let's talk about when you actually enroll into Medicare. Medicare has what they call your initial enrollment period. This is when you are turning 65 and are first eligible to get onto Medicare. Your initial enrollment period is a 7-month window that you're allowed to enroll into Medicare, and you will never receive a penalty. This window starts 3 months before you turn 65. It includes your 65th birth month and goes 3 months after you turn 65. However, most people typically enroll 3 months before they turn 65 so that everything goes into effect once they actually do turn 65. Now, it's important to know that if you're already drawing Social Security, you will automatically be enrolled into Medicare 3 months before you turn 65. So you will get your Medicare card in the mail around 3 months before your 65th birthday. However, if you're not drawing Social Security yet, you must manually enroll, and you can do that during those 7 months of your initial enrollment period. And you can do that one of three ways. Number one, you can call Medicare's number and do it over the phone. Number two, you can call Social Security's number and do it over the phone. Or number three, you can go to ssa.gov and create yourself a Social Security account and enroll online. Or you can just reach out to us and we will help you for no charge whatsoever. We do this for hundreds of clients every single year. Now, another common question that we get is, when is my Medicare going to begin? If you were born between the 2nd and the 31st of the month, your Medicare will go into effect the first of your birth month. So if your birthday is October 15th, your Medicare will actually go into effect October 1st. However, if your birthday was on the 1st of the month, your Medicare will actually go into effect on the 1st of the month prior to your birth month. So if you're born on January 1st, your Medicare will actually start December 1st. Now, I know you've probably heard a lot about Medicare penalties. You've probably also heard that they last forever and that they never go away. Both of those are true. However, there are only really two penalties that you need to avoid. The first penalty is called the Part B late enrollment penalty. And you get this penalty by not enrolling into Medicare Part B during your initial enrollment period, that 7-month window that we discussed before. Now, as long as you enroll in that time, unless you're working past 65 and have group coverage, you will not get penalized. The second penalty is called the Part D late enrollment penalty. And you get this penalty by not adding drug coverage when your Part B of Medicare starts. So as long as you add a drug plan when your Medicare actually goes into effect, you will not receive any of these penalties. Those are the only two penalties that you need to avoid. Okay, now make sure and pay close attention moving forward, because this is the meat and potatoes of how Medicare is going to work for you. So this is the foundation of Medicare. It's Hospital Part A and Medical Part B. Those two together, Part A and Part B, are referred to as Original Medicare or Traditional Medicare. Now, Part A, your hospital coverage, you won't pay anything for as long as you or your spouse worked 40 quarters or 10 years. Part B, on the other hand, is your medical coverage, and most seniors in 2025 pay $185 a month for their Part B premium. However, if you're considered a higher income earner, you will have to pay more. Let's take a look at this chart and see what you'll have to pay for your Medicare Part B. Now you can see at the top of the chart that it says your yearly income status for 2023. That is not a typo. Medicare always looks back at your income from 2 years in the past to decide what you pay for Medicare Part B. So if you're getting on a Medicare in 2025, they'll actually look at your 2023 income. They do this on a yearly basis. So when 2026 rolls around, they'll actually look at your 2024 income. They always look back 2 years. Now, I'm not going to go over this whole chart, but let's take a look at the first two rows. If you're getting on a Medicare this year and you filed individual tax returns in 2023 and you showed less than or equal to $106,000, you will only pay the $185 a month for Part B. There will be no adjustment. However, you can see in the second column, if you made between $106,000 and $133,000, you will have to pay an extra $74 a month, totaling to $259 a month for your Part B. The same rules apply if you filed jointly. If you showed $212,000 or less, you'll only pay the $185 a month. However, if you made between $212,000 and $226,000, you'll pay that extra $74 a month, totaling to the $259 a month. As you can see, the higher your income, the more money you're going to have to pay for Medicare Part B. Now, to keep it simple, it's important to know that Medicare Part A and B only cover you for 80% of your medical and hospital bills. This leaves you with a massive risk being responsible for the other 20%. So let's say, for example, that you only had Medicare Part A and Part B, and you got diagnosed with cancer, and you had $1 million worth of medical bills. You would be responsible for 20% of that, which is $200,000. And there is no cap on that 20%, which is the scary part. However, they do make two options for making that 20% more affordable for you. And we're going to go over both of them. So your first option is keeping original Medicare, so Part A and Part B, and adding what they call a Medicare supplement plan and a prescription drug plan. So what is Medicare supplement? A Medicare supplement is also referred to as a Medigap plan and is extra insurance that you can buy from a private health insurance company to cover the other 20% that Medicare doesn't cover. Now, Medicare has a bunch of different types of Medicare supplements. And as you can see on the chart, they all have different letters. So there's a Medicare supplement plan A, plan B, plan C, all the way to plan N. However, to keep this simple, we're only going to focus on the Medicare Supplement Plan G because it's the most popular supplement plan in 2025. So this is how it would cover you if you took out a Medicare Supplement Plan G. Your Medicare Part A and your Part B would cover 80% of your medical and hospital bills, like we discussed earlier. And then the Plan G supplement would come in and pay the other 20% entirely. So the only thing that you're responsible for is the Part B deductible, which this year in 2025 is $257, meaning once you pay that deductible, you have 100% coverage no matter what happens to you. You could get diagnosed with cancer, have a stroke, and a heart attack all in the same year, and you will only pay the $257. This is why it's the most popular option for Medicare supplements in 2025. Now, here are some of the prices for a male turning 65 and buying a Medicare supplement plan G. However, these prices are not set in stone and can drastically change depending on where you live in the United States. Some states are around this price and other states can be a lot higher. But don't worry, when you book your one-on-one consultation with us, we'll give you the exact pricing for your specific area for Plan G supplements. Now here is the rates for a female turning 65 and taking out a Plan G supplement. Now it's also important to know that you pay this in addition to the $185 a month that you pay for Medicare Part B. Now there are some things that are important to know about Medicare Supplement Plan Gs that will be the exact same no matter what company you choose. Number one, all Plan G supplements are the exact same coverage with every single company. So it doesn't matter if you take United Healthcare or Aetna or Humana. Every Plan G is the exact same with every company. Because Medicare decides what these Plan Gs cover, and all the insurance companies get to decide is how much they charge for them. Number two, all Medicare supplement plans are what they call non-network plans, meaning there is no network of hospitals or doctors that you have to stay within. So you can go to any doctor, any facility in the country that accepts Medicare. So it truly gives you the most amount of freedom when choosing doctors. And number three, all Medicare supplement plans do not include prescription drug coverage. So you will have to purchase a separate drug plan to cover your medications. So let's now take a look at Medicare drug plans and how they work. Exactly like it sounds, a prescription drug plan is a separate plan that you purchase to go alongside your Medicare supplement. Now, typically they cost between $0 and $15 a month. However, if you're on some high dollar medications, you could see that premium get up to all the way $100 or more per month. But the average senior finds themselves typically in that $0 to $15 a month range. Now, it's also important to note that you may still have a copay when picking up your medications. So just because you took out the drug plan does not mean that all your medications will be free when you pick them up. And lastly, it's extremely crucial to do your research on the drug plans because every plan covers medications differently. They also have different formularies, which is just a list of drugs that that plan covers. And they also have different networks of pharmacies that they consider preferred, standard, and out-of-network pharmacies. So let's take a look at this hypothetical drug cost breakdown because I believe it's going to make a lot more sense for you. So let's say that you're taking these 4 medications and you pick them up at a pharmacy that is considered preferred with your plan. You're only going to have to pay $7.10 per month for all 4 of those medications combined. Well, now let's say the same 4 medications, but you pick them up at a standard in-network pharmacy with your plan. You're now going to have to pay $28.60 a month for the same medications. And now let's say you pick up the same 4 medications, but you go to an out-of-network pharmacy. The same 4 medications that were $7 a month are now $233 a month. This is why it is so crucial to do your research on the drug plans because they all cover drugs differently and they all have different pharmacy levels. But again, don't worry because when you book your free one-on-one call, we will run all your medications with all the different drug plans in your area and see which one covers them the best. Okay, so that's your first option of covering the 20% that Part A and Part B doesn't cover. Your second option on the right is Medicare Advantage or Medicare Part C. This is your all-in-one type of plan because it includes drug coverage at no additional cost. So what is Medicare Advantage? Medicare Advantage is also referred to as a Part C plan and is ran by private insurance companies approved by and under contract with Medicare. Now, here are some things that you can expect if you take out a Medicare Advantage plan. You typically won't have any type of premium. So unlike the Medicare Supplement Plan G, you will not have to pay an extra premium other than the Part B premium that you pay to Medicare. However, you will have certain copays when you get things done, which we'll look at here in a second. But you pay copays instead of paying the 20% from Part A and Part B. Now, you'll also have certain doctor and hospital networks that you have to stay within. So you can't just go to any doctor, any hospital in the country. However, a lot of the companies have moved to a national network and have extremely broad networks of doctors and hospitals that you can go and see, which we're also going to check all your doctors on your one-on-one call if Medicare Advantage is the route that you want to go. Now, Medicare Advantage will also have extra benefits built in at no additional cost. So dental coverage, vision, hearing, some of the plans even give you a certain amount of money every month for over-the-counter products. And then, like I said before, you will also have built-in drug coverage at no extra cost. And then lastly, they also have what they call a maximum out-of-pocket, which means there is a ceiling on how much you can be out in a given year. So if the maximum out-of-pocket is $4,000, you know from January through December of every year, you cannot spend more than $4,000 out of your own pocket before you go to 100% coverage. Now, there are a lot of rules with Medicare Advantage, and one of them is that we can't even have the carrier's names next to the benefits. However, this is going to be pretty similar to what you would see in your area. So you can see on this plan, you don't pay a premium each month. However, a doctor visit wouldn't cost anything either. However, a specialist visit would be a $20 copay that you would pay. On this specific plan, a hospital stay, you would pay a copay of $320 a day for the first 5 days that you're in the hospital, and then Medicare would pick up the rest. An MRI on this plan would cost you a $150 copay, and then you can see that the plan gives you a certain amount of money for dental, vision, hearing, and over-the-counter benefits each year that you get included. Now, like we said before, the cost of a Medicare Advantage plan will typically be $0. So you would only pay what you pay for Medicare Part A and Part B. So if you and your spouse worked the 40 quarters or 10 years, you wouldn't pay anything for Part A, and then the Part B, you would just pay the $185 or whatever you pay for Part B according to your income. Now, here are some important things to know about Medicare Advantage. Number one, each Medicare Advantage plan has different benefit amounts and copay amounts. So there's probably 50 different Medicare Advantage plans in your area, and they all have different amounts that they charge for certain services. And they'll also have different amounts that they give you for dental, vision, and hearing. Number two, they will also all cover medications differently on each Medicare Advantage plan. So it's crucial to do your research on the drug plan part as well. Now, as a whole, that's how Medicare is going to cover you when you turn 65. Now it's time to book your one-on-one call to discuss your specific situation. We suggest meeting with us no later than 6 to 8 months out from your 65th birthday so we can plan accordingly. Now, you may be wondering what to expect in your one-on-one call. It's a no pressure, no obligation, 100% free to you call where we will go over both Medicare Advantage and Medicare supplement plans, as well as prescription drug plans specifically in your area. We will also set you up a game plan and a timeline to follow as you get closer to your 65th birth month. It's also, like I said before, 100% free of charge because we get paid through the insurance companies to assist you. So you will never pay us a dime. We will also be your support as you get onto Medicare for years to come with annual plan reviews and customer service 365 days a year, which means no more 1-800 numbers. So go ahead and either call the number on the screen or use the calendar down below and book your one-on-one call. I look forward to meeting with you.